can you let me know if we are good to go?
I will start the live stream now, and I'll let you know when it's up.
Thank you, sir.
All right, you're good to go, Mr. Warden.
Thank you, sir. Good morning, everyone. It's January 28th, and this is, I'm going to call to order council. Madam Clerk, roll call, please. How are we doing?
Thank you, Mr. Warden. We have all members of Grey County Council in attendance today.
Excellent, and welcome all. You're all perky and smiling. Maybe not. Anyways, do we have any declaration of interest from anyone? Seeing none, we'll proceed on. Item number 4, actually 4A, dealing with County Council and Committee of the Whole minutes dated January 14th. I have a mover for that item. That is Councillor Keaveney, and seconded by Councillor O'Leary. Councillors, do we have any need for discussion here? We see no one. So that said, I'm going to call the question. All those in favor of approval? Oh, sorry. Anyone opposed? My apologies. Anyone opposed? Seeing none, that is carried. Item 4B, Committee of the Whole closed meeting minutes dated January 14th, 2021. That is moved by Councillor Hutchison and seconded by Councillor Potter. Any need for discussion there? Seeing none, I will call the question. All those, anyone opposed? Seeing none, that is carried. Thank you very much. And item C, the Long-Term Care Committee of Management minutes dated January 12th, 2021. That is moved by Councillor Patterson and seconded by Councillor Milne. Any discussion? I don't see any hands, so I will call the question. Anyone opposed to approval? Seeing none, that too is carried. Okay, we're on to item number 5. We have no closed meeting matters. And item number 6, reports. We're dealing with the Board of Health minutes. That will be moved by, oh, sorry. Did I make a mistake already? The Board of Health minutes are being moved by Councillor Patterson and seconded by Councillor Milne. Discussion. Actually, I think Dr. Era is here, correct? So
Yes,
Dr.
sir.
Era?
Correct. Through you, Mr. Chair. So the update to the council on 2 fronts, the COVID update and opiate update. I believe it's warranted to provide the update on the recent numbers that we received from 2020 and the summary of the items that took place in 2020 and the work from the health unit. So for the COVID, the current update, as the numbers have been stabilizing, going to a baseline of around 2 to 4 per day, which is quite manageable, quite predictable based on the trajectory we've seen before. The vaccine front, we have plans submitted to the Ministry and presented to the Board of Health in the last meeting. The plan is a comprehensive program for distribution of vaccine depending on different scenarios, and mainly would be related to the supply of vaccine, the type of vaccine, and the amount of it. The task force for Grey Bruce vaccination met 2 times so far, and I believe it's an instrumental committee or instrumental group to execute that plan. Schools have opened this week, and we have high level of confidence based on our experience from the first term in ensuring safety. The rapid testing is another tool that the health unit has been able to ensure. We have 14,000 tests that will be utilized in management of outbreaks, suspect outbreaks, and ruling out false positives in long-term care, schools, retirement homes, and first responder services. So that's in general the update on the COVID front, Mr. Chair. For opioid overdose, it is an emergency that claimed lives in Grey Bruce, and the numbers came out to be 12 deaths in 2020. And I'm going to run a quick comparison to 2019. So in 2019, we had 16 deaths. The number of visits to ER and calls to EMS have increased in 2020 comparing to 19 by about around 10%. And in summary, there is correlation between the first wave and the second wave with increased opioid overdose. The core functions of the programs in the health unit to address opioid have not stopped. Naloxone distribution, needle exchange programs, urgent outreach, and social media and web content have not stopped at all. What we had to decrease capacity in is due to two reasons. One of them is the lockdown and the measures for COVID. For example, public awareness events and in-person group meetings have not proceeded. However, alternatives online and others were available. For example, opioid working group, instead of meeting every 2 months, instead of meeting monthly, we have downsized to meeting once a month. Nevertheless, the achievements, I believe, and it's quite amazing when you look at the small team that's under pressure to support other teams, still manage to provide the following. We're in the process of finalizing naloxone distribution contract with both EMS providers in Grey and Bruce, and this is a tremendous amount of work actually to be established. And thanks to Grey EMS and Bruce EMS for their parallel work on this. We've been successful in being the first health unit in 2020 to get a contract with primary care for naloxone distribution. The 3 hospital systems, also we have been working with them, and we are near completion of a contract to distribute naloxone there as well. New sharps disposal installed in Owen Sound as a trial, and if it's successful, we expect to provide more service in different areas of the 2 counties. We managed to secure one-time funding to pay for enhanced printing material and other resources to support the cause or to support this program. And again, the core functions and the mandated functions have been completely achieved or supported. It's worth mentioning, Mr. Chair, that if I can compare the two emergencies, just because it will help if all partners around the table and our audience would contribute a bit more and be more aware of the 2 emergencies. COVID, by definition, is a pandemic, and we've done really well addressing it, and we have 0 deaths. And when we look at the opioid crisis, despite the fact that it has been there for years, we're still seeing 12 deaths in Grey Bruce. And I do believe in public health, we earn our credit in health protection, and we invested in health promotion. So again, just a reminder for all decision makers, for our partners who might be listening to this, that after the COVID pandemic is over, and I have no doubt it will be over in the near future, I would encourage everybody to zeal our efforts to address the opioid crisis that requires more work and more complexity to achieve. Nevertheless, like the COVID, we've been successful in achieving that control, and I have no doubt we will be able to achieve the control in the second one too. open to questions as always, Mr. Chair.
Thank you very much, Dr. Era. Perhaps before I move to questions, I will allow Councillor Patterson as chair of that board. Do you have anything you want to add?
Thank you, Mr. Warden. Nothing further at this time. Thanks.
Excellent, thank you. So I did see Councillor Milne's hand. Councillor Milne, go ahead.
Just a quick comment, and I wanted to thank Dr. Era for striking a difficult but necessary balance between the two crises. I know it's not easy, but I think Dr. Era has done a great job in doing that, and I commend him and his team for protecting our community from both issues. Thank you.
Thank you, sir. Councillor Desai is on the drug strategy, the Grey Bruce drug strategy. I forgot who the second person is on that, but
Councillor Mackey.
Oh, yeah,
Councillor Mackey.
That's right. He's still there. He was there when I was there. Okay, Councillor Desai, please go ahead.
Thank you, Warden Hicks. I do have a few questions. My first question, of course, is with regards to the stay-at-home orders. If Dr. Era had a crystal ball, does he see the stay-at-home orders for Grey Bruce at the very least being lifted on February 9th instead of being renewed for yet another extended period? Should I just go through all my questions at one time, or sorry, Warden Hicks?
How many questions do you have, sir?
1, 2, 3, 4, 5.
Well, perhaps we'll go one at a time.
Okay.
Certainly through you, Mr. Chair. In Grey Bruce, we all know that a lockdown was not necessary to control the pandemic locally. The lockdown is provincial and would help us and did help us to prevent travel. Stay-at-home order is of a similar nature. I do believe if the province goes to a regional approach, we would be very qualified to lift the stay-at-home order here. However, as you rightly said, I don't have a crystal ball and I don't sit at that table where the decision is made. I can have input and I'll provide similar input to what I just mentioned.
Thank you, Dr. Era. The next question is with regards to vaccines. We've heard that there's delays in the Pfizer vaccine being delivered to Canada. How does that affect the vaccine rollout for Grey Bruce? I saw the email, I think it was a couple of days ago, where we were looking at, I think by the end of next week, having the first line, the population that's in long-term care homes, having them completely vaccinated. Does the Pfizer delays affect the vaccine rollout in Grey Bruce?
Through you, Mr. Chair, definitely it did affect it already. And if I can answer this question by 2 points. The first one, we were scheduled for 2 shipments of 2,000, total of 2,000 vaccines. Both of them were canceled. And we advocated for a different vaccine, and we were successful to get 2 shipments, smaller shipments, of a total of 1,300. So that's the first effect. And that really translated into changing a priority. The first plan was to vaccinate everybody in the long-term care sector, residents, staff, and caregivers. With the new numbers, we opted to only cover the residents, the most vulnerable, where the stats show death occurs. So it did affect. The delay from Pfizer, the way I understand it, is temporary to increase the production. So that might be, at the end of the day, a positive effect in the long run to get more vaccine. And the second point to answer this question, Councillor, it's an emergency. So it is expected that we will have conditions changing and variables changing. And that's where the plans need to be flexible enough to switch from different vaccine to a different one, from one type to a different one. And the changes in supply is already factored and expected. And whether it's national like this one or it could be, international, like the Pfizer vaccine supply issue, or it could be provincial allocation, or it could be national allocation. Those things happen in emergencies, and I would encourage everybody to be patient, that at some point in the near future, we're all going to have the opportunity to have vaccine.
Thank you. My next question was with regards to 70% approximately of the Grey Bruce population being vaccinated. What sort of a timeline are we looking at for that?
Through you, Mr. Chair, the provincial plan is to have that in the phase 2 and 3. So by August, according to the general. Again, there are many caveats and conditions need to be met to achieve that. If there is more supply earlier, it's a matter of weeks, not months. But again, all these variables need to be in place for it to happen.
Thank you, Dr. Era. The next question, and again, this one's a little crystal ball-y. Earlier this week, a Canadian produced vaccine, Medicago, went into clinical trials. In your experience, how long does it take from a vaccine going to clinical trials to it actually being in circulation or being approved by Health Canada, so to speak?
Through you, Mr. Chair, that's someone that's actually not a crystal ball. It usually takes 9 months to a year to be done. 3 stages of clinical trials, and each one of around 3 to 4 months.
Okay, perfect. Thank you. And my last question, COVID-19 had been declared endemic. This was about right around the start of the pandemic or the shutdowns in Canada. What do you think is the way forward in terms of dealing with that on a seasonal or an annual basis? Will we see the mask mandates or the recommendations around the masks become a more sort of a permanent thing that we just live with for the rest of time, or what do you see the way forward in that term? Thank you, Dr. Era.
Through you, Mr. Chair, all pandemics, and that's a common denominator to all of them, what I would expect, and that's supported by science and colleagues' opinion, is going back to normality within a year or two maximum. What we witnessed in 2020 is the birth of a new common cold. COVID, at the end of the day, is one of the common cold family, the coronaviruses. And the fact that there is nobody has immunity to it, that's what makes it a pandemic, and the hospital system can stall, different systems can stall if it burned through. After reaching the herd immunity, people would be exposed to it, and they're going to have the symptoms that they would have, which is in general minor, except for people who would have comorbidities and older adults who've never been exposed to it before. So in a year or two, it will be like common cold. We get it every 2 years, we lose immunity to it, then we get it again, and we'll go back to normal.
Thank you very much, Councillor Desai. And to you and Councillor Mackey, I would say, if you are so inclined, and I don't want to put you on the spot, but if you were able, it would be nice to know what's happening with the Grey Bruce drug strategy with respect to that subcommittee on the opioid crisis. Don't feel a need to put your hand up right away. I realize I'm putting you on the spot. I can move on to Councillor Milne. Did I not see your? No, okay. And Councillor Boddy then.
Great, thank you very much, Doctor. I just want to make some comments on opiates. I know it's not just here. There was something in the media recently on Sudbury on how drastic it is up there, and I know Councillor O'Leary has been asking you questions. Police board the other day, we got a report on recent arrests in Owen Sound, and by luck we got one of the big boys that had come to town to deliver drugs, and we seem to get a lot coming up from Toronto into the area. So we had an undercover officer here. That's apparently the first time in 6 or 7 years that we've actually done that type of operation through policing, which to me was shocking. we've probably got a bit of a message out there that this is an easy target because we haven't been doing that type of policing for a little while, and it's easy for these guys to come in from elsewhere. We got to get through COVID. I recognize that. I was going to say much of what Councillor Milne said, and thanks for trying to balance this. The stats are amazing in that it's not the people on the street with drug issues that we're seeing so much as people in their own homes, mostly male. I think they said 45 to 65. At some point, I think we're going to have to really put pressure on our upper tier governments to provide us with more support. One, in policing to try and get the illegal drug pushers out of our community. And then the other is helping these people that have the addictions to get off the addictions or try and get them before they get into them. It is really scary numbers, I think, and especially when we know that we've got, I'll never say it right, but naloxone out there. And probably the overdoses are much more severe in number than we know because people have been able to reverse the addiction before they get to the hospital, etc. It continues to be important not to blame, continues to be important to encourage people to go to hospitals and get the help. But I look forward to being able to sit down with everybody that's involved. And I guess maybe that's what we're already doing at the county committee level, but really starting to put pressure on our representatives provincially and federally to try and get us more help to try and tackle this problem, because I think it is something that's just scary. Anyway, those are my thoughts. Thank you.
Thank you very much, Councillor Boddy. Madam Clerk, I don't see any other hands.
No, sir.
If,
I see Dr. Era has maybe a response.
through you,
Dr. Era?
Mr. Chair, I just wanted to add on my last question about wearing a mask. Since it has been normalized, I would expect that in the future, mask could be worn for protection of other diseases as well. Like none of us would have worn a mask because we have a common cold when we go to grocery store. That social norm might be protective in the future. Just to be complete in that question. And thank you, Mayor Boddy, for, if I may, through you, Mr. Chair, thank you for that, for these remarks and for addressing that the issue really need. Despite the fact that the numbers are lower in death, each preventable death is tragedy, and the fact that we are able to control a pandemic with our local resources, with the support from the province, I have no doubt we can address the opioid crisis when we come out of this emergency. There is a sequence in the management of emergencies. If you reverse it, we know COVID requires 10 months to control, or a year, or in this case, only 4 months. The opioid crisis requires more than that. It's a complex issue that lends itself to early childhood, to poverty, to housing, to many issues that in the normal days we have not been able to address unless we tackle it for years. So reversing the order, some people suggest, why are you focusing on the COVID? Reversing the order to actually abandon the COVID emergency and focus on opiate right now, two things might not work. One, the credit and the credibility that we would earn to utilize down the road in addressing opiate will not be there. Second thing, the rest of the system is busy with COVID. So if we're able to be successful in convincing a person to go to a rehab and they go to the healthcare system and the healthcare system is not as available, rightly so because of COVID, we might be running into a phenomenon called learned hopelessness, which if a person repeatedly tried to recover and they were not, they lost that chance. And from system point of view, if we're trying to achieve that control over opioid, which requires all partners, like you rightly said, the provincial, the federal level, the local level, the different agencies in the local level, if we're not able, if we try to push it forward right now, we might not be able to get it off the ground, and we lose that chance that we will have in 3-4 months from now. But I do believe, and Mayor Council O'Leary, I know he has strong passion to this, and I really, if we can channel that passion and augment it through every one of us, that this is doable, and we need not to lose the momentum with this issue. Again, many people can do many things, and decision makers are the people who can mobilize things. So if we can, until the end of the emergency, support the health unit with the initiative that we usually have, whether it's in hosting more meetings instead of us hosting them, to get us support, and that will be optimal. Thank you.
Thank you, sir. Councillor Soever.
Yes, thank you, Mr. Warden. I'd like to follow up on Councillor Body's comments. Certainly, it's very true that a lot of the drugs come from the other parts of Ontario, and you know, and we see that here in the town of Blue Mountains as well, with the many visitors that we have. And in fact, recently our police detachment, the Collingwood Blue Mountains detachment, Inspector Shannon reported they do about 1 warrant a week that's drug related. So they, you know, so they are finding a lot of drugs, and recently they had a very big seizure and involved handguns as well. And I think there does need to be coordination province-wide. And this is one of the advantages we have here, in that the OPP does our policing, and that brings a lot of resources like their intelligence unit, their guns and gangs unit, and their drug unit into play. And so they have had quite a bit of success. We still have a huge problem, but we found that, you know, just the fact that we do have the OPP policing here is a big advantage in having the resources that allow us to see what's going on province-wide and deal with it when it arrives in our community.
Thank you, Councillor Soever. Okay, I think that we appear to have exhausted everyone. Oh, Councillor Mackey.
Thanks, Mr. Warden. And I know you tried to put us on the spot, so I'll try to respond. It's certainly a dynamic working group, and you know, the funding that we as a county and Bruce County put into the working group is certainly money well spent. You know, we have a cross section of all the social service agencies, mental health agencies. Just recently, they've gathered a group of people with lived experience that will help guide the direction. And you know, opioids are certainly a problem, but I can assure you that the group hasn't lost sight of the issue of alcohol within Grey and Bruce. And the number of emergency visits to alcohol is far superior to that of drugs and opioids. So we want to make sure that the alcohol is still at the forefront also. It's certainly affecting a number of people, but I just want to, you know, on behalf of Councillor Desai and myself, say that the money that we are contributing is being well spent, and there's good work being done in the health unit. And Barb is one of the co-chairs, has done a lot of valuable work. So I certainly appreciate it. Thank you.
Thank you, Councillor Mackey. All right, we've had a very good discussion. I want to thank everyone. This is important stuff. And Dr. Era, thank you as well for attending.
Thank you.
I'm going to call the question on the motion before us. Is there anyone opposed? That is carried. Thank you very much. So we're on to item 7, bylaws. We have 2 bylaws before us, 5105 and 5106. Those are being moved by Councillor Mackey and seconded by Councillor Woodbury. Is there any need for discussion on these? I don't. Oh, did I see your hand, Councillor Body? Or are we just itching or something? Okay. All right. So anyone opposed? That is also carried. And lastly, we have a motion to adjourn this meeting, moved by Councillor O'Leary and seconded by Councillor Hutchison. Anyone opposed? That too is carried. We'll just take a quick second to switch our monitors over. At least I will anyways. Move into committee of the whole in just a quick sec. Close this out.
Mr. Warden, we did
Yes.
just step over good news and celebrations.
Oh, did we? My apologies. And now we've adjourned. Can I go back? You're muted.
Yes, let's call the committee of the whole to order. And then we could add good news and celebrations to there with council's permission.
My apologies on that, folks. Just give me a quick second here. Switch over. Okay, so I'll call committee of the whole to order. Is there any declaration of interest? Seeing none, we will move to good news and celebrations. Is there anything that anyone wants to announce? Just raise your hand and I will acknowledge you. I don't see anyone's hands. Not to suggest at all that there isn't any good news. There's always good news happening. Councillor Suever.
Yes, thank you, Mr. Warden. Just quick good news. The Blue Mountain Village Association is again doing an early opening of their grant applications. So they have $15,000. They're looking to distribute 15 $1,000 grants to organizations within our community and the surrounding communities that are perhaps smaller organizations that you know are struggling with funding these days, and so those applications are open now, and or I think this week anyway, and then there is an opportunity, and that process will be relatively rapid. So if there are any organizations out there that wish to apply, I think it would be a good opportunity to top up your funding a little bit.
Very good. Thank you very much. I see Councillor Keaveney next.
Thank you, Mr. Warden. Good morning, everyone. I know everyone has lots of development going on in their communities, but there was an initial public session last night in Meaford that is really quite exciting for us on 6 acres of waterfront property, the former Stanley Knight flooring company. And we've been looking forward to this announcement for some time now with a development inclusive of a 78-room hotel, 120 rental apartments, and 78 townhomes all overlooking Georgian Bay, and a boardwalk along the front is being proposed that we hope eventually could connect to Memorial Park. So it's just exciting news for us in Meaford to think that we could finally be seeing a hotel on our waterfront. Thank you.
Very good, Councillor Keaveney. Thank you for that. I don't see any other hands, Madam Clerk, so I think we can move on. We're on to item number 3, which is our delegations. We have 2. First, we're going to hear from, excuse me, Tuan Peters. He's the CEO and president of ATEL. Tuan with us?
Yep, I'm just moving him in as a panelist, Mr. Warden.
Okay. And by the way, his slides were available. It's at the I guess it's in your packages if you're using your iPad, but also on the public website. The slides are there as well.
Want to start video? Go back.
Start video.
Yeah.
There we go.
Good morning. Are we ready to start?
Yes, we are. Good morning, sir, and welcome. You have the floor.
Okay. Good morning, everybody. Warden, councillors, thank you for the invitation. We're quite excited about what we're able to do. It's also kind of interesting that the SWIFT funding got originated and started through the County of Grey. So I think there's a lot of kudos that need to be passed around, and we're fortunate enough to take part of it and win a substantial piece in the County of Grey. So what I'm thinking is, if that's okay with you, is kind of go a little bit of an overview of the project, and then we can open for questions.
Very good, sir.
I could share the screen. everybody see the screen?
Yes, we can.
Okay, so a little bit about ATEL. We're local and have our office in Holstein. We've been around since 2010. Our mandate always has been rural broadband to improve the rural communities. We currently have about 2,500 subscribers through wireless. We launched fiber to the home in 2017. Did a little bit of pilot projects and basically got our feet good and wet, so we knew what we were doing. Developed the processes. Right now, we have over 20 million committed to rural broadband. We secured about 12 million from SWIFT. We also won a project in Wellington, so we're first in connecting subscribers to our SWIFT network. We're also the first ones in completing a SWIFT project. Construction has already started in West Grey and Southgate, and our project will basically encompasses is within Southgate and West Grey, the majority of it. There's about 1,300 passed with a fiber to the home. And I forgot to put, yeah, oh, that's right. And 700 are going to be enabled with 5010 wireless. We kind of leveraged our wireless infrastructure to improve the quality of service for and higher capacities on our existing network. So much of the fiber goes to our existing towers. One of the biggest challenges we have is getting enough backhaul to the towers to distribute the signal. So it's a temporary sort of fix. I think the long goal is to get everything on fiber, but it gets more speeds and more bigger packages out to more people quicker. So it's a good tool for us to leverage what we have. In total, it's about 145 kilometers of fiber. We're hoping the first services will be starting in May. A lot of the project's going to take a little longer. We have certain areas in the Saugeen Conservation Authority that we can't drill and connect until the water levels are down. The Saugeen Valley Conservation Authority has been very good to work with us. If the water levels go down sooner, they'll allow us to start sooner. And we are targeting completion for December 21st. This is a SWIFT network. It kind of shows the coverage. They have an excellent website. I encourage anybody to visit, and I expect most have been on it already. It's very intuitive and explains a lot. One of the challenges we have with the SWIFT applications is, as you can see, the large blue area there that's claimed as served. Once an area is claimed as served, that makes it ineligible. We actually had quite a bit designed for Grey Highlands as well, but we had to pull it off the shelf for the applications. And to the north, you can see the ExploreNet bids there, and this is the southern part is where we're building here. On our website, we do show the coverage area. And we also will be posting progress as the construction moves on. So clicking on that link will basically give you this map. It shows where all the fiber is going. We'll be updating dates and as things progress, so that people can check in and see how progress is going. We're also trying to advise where the construction is happening. And we're just setting up all the project management to keep this up to date. So one of the things we get is, what about us? I'm not getting fiber, you know. So it's quite a, SWIFT is a good start. I think from the meeting we had the other day, it covers about 25% of the underserved homes, 20 to 25%. There's more coming. This by no means are we done. We are making applications to the UBF fund. It might be SWIFT 2.0. There's other grants out there as well. We are also committed to expanding fiber extension through on our own budget. The municipalities have been great. Southgate and West Grey have been very supportive and very much appreciated. Any funds that we save, we are going to be extending some of these fiber lines and try to meet those people requirements or wishes, I guess. Okay, I will close that. How do I do that now? So the major communities, just to give a bit of an understanding, the primary connection will be in Durham. It'll be a belt upstream. Eventually, that'll be connected to Shelburne, where we can get bandwidth from Rogers much more cost effectively. Because there's limited competition up here, the price is at a premium for us to connect as well. Through these networks, I think that's going to stimulate a lot of competition to get that overall cost down as well, but for us and for others. We are going to make the ability to, it's an open access network. People will be able to connect at any point. I believe this network has more than 500 interconnect points. It's going to cover the village of Holstein, which is our hometown. We're really happy about that. Drumore, there's a lot of little communities along the way, and going over to Elm Park and up to the subdivision of Forest Creek and near Elmwood, Habermill. And those are the primary targets that we did. One of the reasons the routes ended up this way, there's requirements for SWIFT to connect as many homes as possible for the least amount of money asked. So one thing that this model does, we end up picking pockets where the homes are more dense to make it more appealing, a more appealing application. The entire network is designed to be able to expand into all the other areas, and we hope to accomplish some of that through the UBF fund. And that's about it. So if there's any questions, we can go right to them if there's. I get this back.
Right. See if we can see our members again. Okay, thank you very much for that presentation. I see some hands, and I would just say, before I acknowledge those individuals, I'm personally really happy to see the project extended north on Allen Park Road there, where I know that there's a Telesat facility there in West Gray, that from the beginning, when we were just talking about projects coming to Gray County, Telesat was one of the groups that was talking about a big need for redundancy in their service. So I'm really happy to see that that project will be fulfilled. We have questions, Councillor Milne.
Thank you, Mr. Warden, and good morning, everyone, and good morning, Tuan. Not really a question, just a comment. I wanted to thank Tuan for his efforts and ATEL. We're pretty proud in Southgate here. It's a homegrown company that still is here, and we're real happy about that. I wanted to be clear about one thing. I live in Drumore. Actually, I'm in the suburbs of Drumore, and there's absolutely no benefit to being a counselor in terms of whether the fiber goes past your home. It comes within, I can almost throw a baseball to the end of the wire, but Tuan tells me, be patient. All good things come to those that wait. So I wait with bated breath. Nonetheless, we're real happy to host the improvements that Tuan is proposing for our community. And so those are my comments. Thanks again, Tuan, for your efforts. And that's all. Thank you.
Thank you, Councillor Milne. And I can hear the violins playing. No, in all seriousness, you're not the only one that's in that circumstance.
The violins might be playing, but you can't hear them that good because there's no high speed.
Very well. Okay, Councillor Potter.
Thank you, and it is good that the cable is so close to Councillor Milne's house that he could walk out and drop a baseball. But my question is for Tuan. Thank you for your presentation. It's great to see this proceeding across the county. We are in the midst of planning a public meeting. I hope you've received an invitation to that, and I hope you will take part. If not, let me know and I'll see that you do get one. But it will be a chance to introduce yourself to us and our public. And there won't be any public questions, just a chance for you to explain what you do and what services are available. And we'd love to have you take part in that. Thank you.
Very good. And Councillor Potter, the date of that meeting?
Sorry, it's February the 16th at, I believe, the mayor will correct me if I'm wrong, it's 3:30, I believe.
Excellent. And how can people get more details about joining that meeting?
Just get in touch with me and I will see that that you get information, because the public can attend. They can send in written questions after. This is really a chance to hear what is available to us. We have a few indications of interest already and we're looking for more.
Excellent, sir.
And that will be virtual. We will send the link.
Thank you. Councillor Soever, you're next.
Yes, thank you, Mr. Warden. And I'd like to thank Tuan for his presentation. And I'm very impressed with this project. I'm less impressed with some others, but this one truly seems to serve a rural area. And I think, you know, this is one of the shortcomings of SWIFT. I did look at all of their projects and they serve areas with an average of 17.4 houses per kilometer. So there's many rural areas in Ontario where obviously there aren't 17 houses per kilometer, and very few of those areas are getting served. Yet projects like the Garifraxa Woods one in the corner of Orangeville, where they served a small number of high-end homes with an average value of about $2.8 million. You know, so I'm very happy to see projects like Tuan's here, where we are actually serving rural areas as well as some of the towns, because you know, certainly some of the projects seem to be picking the high density areas out. And I'm very concerned that 5 or 10 years down the road, all of the high density, high end clients will have been served, and there will be very little left in the rural areas. And so it will be impossible to get people to actually service these rural areas once the adjacent high density areas have been served. So I'm very pleased. Congratulations, Tuan. And as Mayor Potter said, we are, you know, we've launched our Rabbit Task Force, Rural Access to Broadband Internet Technology. And we are inviting service providers to come and introduce themselves. And we will then work with the service providers to support any grant applications they make to other programs as well as SWIFT, and facilitate access also to rural roads. I know there's been some very interesting projects done where people have actually allowed the plowing of shoulder roads to insert the fiber without you know, the need to do extensive trenching, and then so that there are ways the municipality can help. So I'm very pleased to see that your project did go ahead, and it is one of the better ones in terms of serving our truly rural areas.
Thank you very much, Councillor Soever. Mr. Peters, I don't know if you want to respond to the issue around density.
So you're absolutely correct, Councillor Soever, that that's sort of the way this project worked. That's what determined a lot of our routes. It might be interesting to see that the UBF fund takes a totally different approach. They want comprehensive coverage, and they want that last house a mile down the road covered as well. So in combination, if we're successful, that'll really, really solve the people that are left out, the less dense populated areas. So we're hopeful, whether it's us or somebody else. I think there's lots of windows that are going to be an opportunity that might close that gap. Thank you.
Thank you, sir. And Councillor Robinson, I'm going to be going to you next, but I would add on the subject of density, that Councillor Soever is not wrong in identifying that many of the projects seem to be focusing on those higher density areas. And it's not the fault of the internet service providers, by the way. It was a criteria of the funding, where persons who are providing the funds say, we want you to pass as many premises as possible. So there was a big focus on getting as many premises passed as possible. So naturally, you're going to see the proposals come in the way they do. But if we are going to get to those last mile type projects, internet service providers are going to have to be highly incentivized. And we're going to have a change in this philosophy of we give higher marks for how many premises you reach. Councillor Robinson, you are next.
Well, thank you, Mr. Warden, and good morning to everyone. Tuan, I just want to say thank you very much for the detailed update. It's very nice to see that there are broadband projects taking place in Grey County just to service our residents, businesses, and tourists. When they come back again. One of the points that I want to make, and I've been hearing it throughout this presentation, it's a local rural company improving access to broadband to our local rural communities. So to that, Tuan, I say very well done. And Warden Hicks, I think it's important that SWIFT was also involved in this. Thank you.
Thank you, Madam Clerk. I don't see any other hands.
No, sir.
Good. So with that said, Mr. Peters, I want to thank you very, very much for your presentation. Exciting to see these things happening, certainly. And I would say that about 50% of the SWIFT projects to date are with your sort of large internet service providers, the Rogers and Bell. But about 50% is small internet service providers like ATEL. And I would dare say that if we are going to get those last mile projects done, it's going to be the small internet service providers who are going to step up and get that done. We'll see in the course of time if that comes to fruition, but that's my guess. Thank you very much again for your presentation.
Thank you very much.
Okay, we have next John Farmer, Coordinator of Violence Prevention, Grey Bruce, and he's going to give us an update.
Mr. Warden, his time is at 10:30. So I'm wondering, with your permission, if we go to the consent agenda and then we can circle back to Mr. Farmer.
Very good, we can do that. So we have that's item number 5. The consent agenda is being moved by Councillor Milne and seconded by Councillor Mackey. Do we have any discussion on the consent agenda? Anything need to be pulled? I don't see any hands. Seeing none,
Yes,
then.
Sorry, yes, I do see Councillor Soever.
Councillor Soever, go right ahead.
Yes, I'd like to pull items A, C, and E. That would be the Hanover Owen Sound Task Force, the SWIFT project update, and the Blue Mountain Village Association request for support.
Okay, anyone else? Seeing none, then I will call the question. All those in favor of the consent agenda except A, C, and E. Is there anyone opposed? Sorry, I'm messing you guys up, and you're doing very well when I say all in favor, but I mean to say, is there anyone opposed? I see none, so that too is carried. We still have 5 minutes, Madam Clerk. I'm in your hands.
I think Savannah's report on the Clean Energy Frontier project will be fairly short, so I think we could probably proceed to that, just in case there are others that are interested in hearing Mr. Farmer's presentation.
Of course. All right, so that we will deal with item 6A. Savannah, you're on deck. Moved by Councillor Carlton, seconded by Councillor O'Leary. And Savannah, you have the floor.
Good morning, Council. Thank you. As you will know, this is a report following up from the delegation that we had from Chad Richards in December, asking for the county to join officially as part of the Clean Energy Frontier program. So we promised that we would bring a report back just to give you a little bit more context as to what the program is, how it's shifting, and give you a little bit of history too, because we actually joined the Nuclear Economic Development and Innovation Initiative in 2016, when Bruce Power started working towards the major component replacement and brought the 3 counties together in a partnership. So since that time, it's been an incredibly successful partnership. We've seen more than 60 suppliers locate locally, and we've worked together to help prepare for the influx of demand on our skilled trades because of this major component replacement. So in September of 2020, Bruce Power, Bruce County, and the Nuclear Innovation Institute brought this group back together and looking to enter a new phase known now as the Clean Energy Frontier program. And what we see with this is a real shift now towards education and marketing and telling the story of what clean energy looks like in the region and in Ontario. So there are 5 different goals that are being proposed. We still need to go through the regional committee to approve these goals, which is why we have a brief attached to the report for you, just to give you that background. But it hasn't been formally adopted by that larger council yet. What we do see, as I mentioned, is that shift to the marketing side of things. And we want to make sure as we go forward, knowing that there's going to be a lot of storytelling and a lot of education to come, just to make sure that you're comfortable as we go through each of those pieces. So what we're asking council is to formally become part of the Clean Energy Frontier program, and that we recommend bringing a staff report back after each of those regional liaison committees so that we can bring council up to speed on what the direction is, what the messaging is, what those tactics and strategies are, to make sure that you are on board with the messaging, with the direction as we go through this, because we know things can change very quickly, and we just want to make sure that we keep that transparency. So there is a brief attached if you have any questions, but otherwise, both the CAO, Kim Wingrove, and myself, we are appointed members to the Regional Liaison Committee. So we are sitting there on behalf of Grey County, and we'll bring this information back. And then City of Owen Sound and Town of Hanover also have a seat on the committee as part of that larger strategy. So that is the report in a nutshell. If you have any questions, please let me know.
I'm muted. Thank you very much, Savannah. Council, any questions? Seeing none, I'm going to then call the question. All those in favor, sorry, I'll get it right yet. Anyone opposed to the motion? Seeing none, I'm going to say that that too is carried. We're still a minute or two ahead of schedule. Can we go ahead, Madam Clerk?
Yeah, go ahead with our delegation. Yes.
Oh, thank you. They're here and ready. John Farmer.
I am. If everyone can hear me, then I'll say that we're doing well. Good morning, Council. Thank you for accepting my delegation. I had originally reached out hoping to speak ahead of December the 6th, but you were a popular destination and the delegation slots were full ahead of that time. It's fortunate though that we were able to schedule for now, because I'll be speaking today about some recent releases and current projects. I'm now going to attempt to share the slideshow that you would have had in your package, and as with all internet-based meetings, nothing will go wrong and you'll be able to see and hear everything perfectly. I am representing today Violence Prevention Grey Bruce as the coordinator. And part of nothing going wrong is there. So we are the local Violence Against Women Community Coordinating Committee. We have more than 40 member organizations represented across our committee of the whole and subcommittees. Violence Prevention Grey Bruce was originally founded in the mid-90s and has had a number of names in that time, as well as variable funding. But we have persisted with the goal of bringing together and the various sectors and organizations that are working to prevent gender-based violence and respond to gender-based violence. For those of you who may not be familiar with the term, gender-based violence includes all violence that is motivated by or targets people because of their gender or their sex. So that includes violence against women and the various forms of violence, whether that's intimate partner violence, domestic violence, sexual violence, any and all of the above. We recognize that the roots of violence are common, and so we can't address just one branch of the tree when the roots are shared. We also work to raise public awareness about the issues and to encourage community participation in violence prevention and response. That work takes the form of meetings of the whole quarterly, as well as subcommittee and project focused work, looking specifically at domestic and sexual violence, anti-human trafficking work, elder abuse prevention, collaborative protocols to improve the way that we work together, and public outreach and communication. Most recently, you may have seen in the news in the fall that we hosted an anti-human trafficking community forum, which included 2 events, one for the public at large, one for service providers. A recording of that is available on our website to improve community awareness. We release articles throughout the 16 days of activism and participate in the December 6th vigils. We recently concluded an Art for Change contest, which saw submissions of art by young people from grades 7 to 12, as well as adults with developmental and intellectual disabilities. We asked them to create art about the theme of healthy and unhealthy relationships, and they created some really amazing projects there. We are also in the midst right now of an elder abuse poster and presentation campaign, as well as releasing the latest snapshot numbers that we collected. For those of you who were sitting on council, I presented just over a year ago about our first snapshot project, and I'm here today with an update. The elder abuse resource poster was funded in part by, well, in totality by the Community Foundation of Grey Bruce. We've designed 2 posters that collect in one place in a large font the resources and organizations available to support elders or seniors experiencing violence in Grey Bruce. There are 2 sizes of the poster available, and we're in the process of reaching out to make them, well, to distribute them widely across Grey and Bruce counties. Last week, I got a call from the Bruce County Libraries, and we delivered 51 posters to them this week. We're also, as part of this awareness project, doing public outreach and engagement, and folks can request either posters or presentations anytime between now and March within the lifetime of that grant. We are partnering with Elder Abuse Prevention Ontario, which is a province-wide organization, to share that information and their expertise. And we know that during the pandemic, calls to their senior safety line, which is available to seniors who might be experiencing violence, or people who would be supporting them for more information and for support and connection to services, those calls are up 300% over the course of the pandemic. So it's a timely project, and we welcome anyone who might be watching or participating in the meeting today who would be interested to reach out for more information and those resources. I also come, as I mentioned, with a snapshot of gender-based violence and violence against women for, in this time, the fiscal years of 2018 to 2019 and 2019-2020. There are a lot of numbers here. I trust that you'll have had a chance to review some of them in preparation for the meeting today. Some of the key numbers to look at are the rates of incidents reported to police and the number of people who are seeking support through crisis and helplines, as well as through medical care. We know that the majority of people who experience domestic violence and sexual violence don't reach out for support, that they live with the pain and the consequence of that on their own for a variety of reasons, because of stigma, because of shame, because of fear of their the perpetrator, as well as barriers to accessing care and service, which in Grey and Bruce counties are large. We have we're bigger than PEI, as we're fond of pointing out. And it's easy to think that these issues are historic, that we're past the point of violence in relationships, keeping women in the home and out of the workforce, or that after Me Too, no one is having a hard time speaking about or connecting with supports around sexual violence, but that's not the case. In 2019, for that fiscal year, there was an average of 2.4 calls a day to police services in Grey and Bruce counties for support related to domestic violence. During that same time, there were more than 26 calls a day to the crisis and helplines run by the various VAW organizations, so Violence Against Women organizations in Grey and Bruce counties. The numbers for that particular line were included or provided by Women's House serving Bruce Grey, by the Women's Center, and by Kabeshoan at Saugeen First Nation. We know that these issues are continuing, and one of the ways that they continue is through the silence that surrounds them. So it's only by talking about and raising awareness about and asking the question of how do we address them that we can address these issues. People are disproportionately experiencing violence when they are also marginalized. And that can be by race, by education, by age, by gender, sex, or gender identity, as well as just by where they live. You just heard a presentation about the trouble with getting internet service to people living rurally, and the ability for rural folks to access service and support also continues to be an issue. This is just the tip of the iceberg, but we release it to start the conversation and to encourage people to participate in that work. And as leaders in our communities, there are particular things that you can do. We also know that because the most recent snapshot of 2019-2020 ended with data at the end of March, that does not capture the current reality. The unofficial reports from our partner and member organizations are that rates of violence are increasing at the same time that it's more difficult for people to access services and supports. And the pandemic is taking up a lot of space in headlines. There's been a lot of great work done to mobilize and support everyone from businesses to service providers and the community at large, but there's more work yet to do with all of these barriers. The rates of domestic violence and intimate partner violence increasing during this time are for a variety of reasons. When people spend more time at home with their abusers, they're more at risk. With economic stress and the inability to access the other formal and informal supports that help to stabilize people's lives, it's harder to cope or to access the kind of harm reduction that folks rely on in their day-to-day lives. We also know that women are disproportionately being impacted by this pandemic, especially economically, as they're more likely to work at higher risk, low wage, frontline positions. We talk about essential workers and hero pay, but the value of the work that women are doing in our communities and in our society are not always represented in the stability and the support that they receive as a result of that work. It's been labeled a she session, that women are dropping into the economy more quickly and re-entering more slowly. It demands a she-covery, and it's up to us as communities to figure out what that's going to look like. I've spoken about the decreases in informal and formal supports. There are just more barriers right now, as well as more stresses as kids are at home. And to see a full report on gender-based violence in Canada during the COVID-19 pandemic and other issues and recommendations, I've included a link to the Centre for Research and Education on Violence Against Women, which comes out of London, Ontario. And that brings us specifically to what municipalities can do to support violence prevention. Some of this work you're already doing. I was really excited to see the announcements about housing supports in the news over the last couple of weeks, with Grey County directing funding to support affordable, accessible housing. All of your policy decisions impact people's lives. And anytime that's the case, it requires a lens of the social determinants of health and a gender-based analysis lens. So a policy that might seem great for the bottom line from a 30,000-foot perspective might not be equitably supporting people who are marginalized by their sex or their gender. By reducing the vulnerability and marginalization of the most vulnerable people, we do better work to supporting safety for all. As employers, we know that employers have legal obligations to provide domestic violence response training and safety to their employees. And you folks also have the potential in all your fields of work to advocate for projects that support equity and remove barriers to access to the things that make people's lives safer. So I was going to say I stand before you today, but I'm on your screen before you today, just to bring that back to the agenda. With so many pressing issues facing our municipalities and our county, your schedules are often full of the material, and it's important to remember that the social and those matters of safety are always there underlying those issues as well. And a lot of this work is also being supported, full kudos, by the Community Safety and Wellbeing Plan. That has a lot of potential to help us to improve access to supports for folk. And it's up to us to make sure that this work is ongoing. We're never done. We're never done. And that, I think, wraps things up for me. I would love to open the floor up to any questions. I may have had a couple of coffees this morning, so if I went too quickly and there's anything that I can help to clarify, I'm happy to do that. And I'm really grateful for the time to present to you and speak about these issues in such a public way to leadership in our community.
Well, thank you very much for that update. It's very timely indeed, because I was just reading, I believe yesterday, that a Hanover police officer was assaulted while she was responding to, allegedly, I should say, while she was responding to a domestic call. I see Councillor O'Leary had his hand up. Councillor O'Leary?
Thank you, Mr. Warden, and good morning, John. Thanks for your presentation. Just had a question. Like, some of these numbers are just scary, but 190 women turned away from shelter. What exactly does that mean? Sent back into a violent situation, or is there, like, what happens there?
The particulars of what happens in a situation like that depend on the situation and resources at the time. The shelters locally work with other housing supports to try to find alternate safe places for them to be. But women and children are turned away when the rooms are full. And that's also an issue that's been aggravated during the COVID-19 pandemic, as physical distancing and quarantine requirements have reduced capacity at the shelters. So what happens to those 100 and some women? It depends for each of them. Some people end up couch surfing. Some people end up in motels. The shelters work very hard to make sure that they're connecting women with other safe places. But when the rooms are full, there's not a lot that they can do.
Okay, thanks. And thanks again for your presentation.
Thank you. Councillor Potter?
Yes, thank you for your presentation. And to be honest, I'm heartened that the numbers aren't worse than they are, given the situation. Maybe we can be at least a little thankful for that, but they are bad. And what I'm wondering is, are you noticing that as time goes by, there is an increase? In other words, is there some growing urgency to do what we can? For example, more affordable housing, making that more of a priority than we have so far. More ways of dealing with these issues. We are limited, I realize, but I'm just worried that the urgency will grow as the pandemic goes along, and people maybe, we've heard that some people are losing hope and getting even more frustrated. So are you seeing any sign of that?
Yeah. The COVID-19 pandemic has absolutely increased the urgency for many people. The challenge is that the kind of long-term solutions also take a long time to put into place. I really appreciate your reference to affordable housing there. It's a major barrier, not just for and on a variety of levels. Women who don't have access to a safe, affordable place to be can, out of necessity, be forced to stay in abusive or unsafe relationships because it's that or homelessness in their eyes. Well, and in their situations. There's also a backlog created as women in shelter struggle to find affordable places to move out to from the shelter. It means that the shelter stays lengthen as as it becomes more difficult for folks to find affordable housing. So I would absolutely say that the urgency is there. Numbers can also be, it's complex because if people report more readily, as there's less social stigma, then the numbers go up. So in some ways, over our lifetimes, we may hope that the number of reported incidences would go up to indicate that there's less silence and less people choosing not to or not being able to access support before we see an overall decrease. But that's on the scale of generations, really, as we know that intergenerational violence plays a big impact.
Thank you very much. Councillor Mackey.
Thanks, Mr. Warden, and thanks very much, John, for the work that you do. In your presentation, you spoke about elder abuse, and I'm just wondering, is there any legislation, there's certainly legislation that professionals need to report child abuse, but is there any legislation that requires people to report elder abuse? And also, what organizations are out there to help support individuals that are suffering from elder abuse? Thank you.
So my understanding of responsibility to report is that would absolutely apply in long-term care settings, but that elder abuse is like any other crime, where if as community members, if we see it, we can report. Professionals, to my understanding, and this is where I'm a bit of a generalist, and so it would be worth, I don't want to speak out of turn, but to my understanding, if anyone is working with a vulnerable population and they perceive that person to be at risk or currently experiencing violence, that there are responsibilities to do something about that. I'm sure that depends on the policies and protocols of specific organizations and sectors.
I know that Barb and Anne Marie are on deck, and I don't want to put you folks under pressure, but you may have something to add there. I don't believe that there's an equivalent to the Child and Family Services Act, which did require the abuse of children. But is there anything that you folks can add, either Barb or Anne Marie? Probably not. I didn't see any other.
Oh, it looks like Anne Marie may be trying to speak, but I don't know.
She's on mute. Oh, she's not on mute. It just doesn't have sound.
I can't see her, so I can't tell. Is there any other questions while we wait?
Barb does have her hand up as well.
Barb might have something to add there.
Go ahead, Barb.
I'll give it a shot, see if my volume is working. Can you hear me?
Perfectly, I can hear you, yes.
Okay. I wanted to mention that we have our staff, we routinely remind staff that if there are indicators of circumstances of violence in homes, that we do reach out to our partners, and we're very fortunate to have John and his folks, the shelters, the Women's Center, all kinds of partners that we meet regularly with. They're party to the Poverty Task Forces agencies as well. And so we're very interconnected, and we know we're not able to capture everything, but we do have a protocol. And so there are things that people are asking that would trigger the conversations when we have applications coming through for social assistance. We also have human trafficking work being done in our communities. So, there are definitely incidents where staff are given an opportunity to be able to contribute and assist in those ways. But the mandate is very different for children. And so I would like to see some further work at a regulatory manner for this, but we do support our staff in doing so. And I know Anne Marie is part of that as well. Her team works alongside ours in the same capacity.
Thank you, Barb. I don't see any other hands up, Madam Chair. Madam Clerk.
Thank you. No, sir, I don't see
Okay.
him either.
So I guess with that said, Mr. Farmer, I want to thank you very much. Very timely presentation and good discussion.
Yeah, thank you for your interest, and I'll be in touch when we have another snapshot in the future. Take care.
Thank you, sir. Okay, I know that we have item 6B, the ambulance service review. on deck with Kevin, but I'm going to suggest, we've been sitting for an hour and 20 minutes. So I'm going to suggest that we take a short break. Would 10 minutes be sufficient? Just nod heads if you think that would be fine. I see a lot of nodding heads. So with that said, it's now 10:50. If we would come back at 11, and Kevin, you're on deck. Okay, folks? See you in 10.
Cameras and microphones off, please.
Okay. Looks like most of us are back. We definitely have quorum. Are we live and able to go again, Rob? We are. I see Madam Clerk nodding. Okay, I'm going to call us back together. We are now on item 6B, the ambulance service review final report. That is moved by Councillor Hutchison and seconded by Councillor Potter. Kevin McNabb, you have the floor.
Morning, Council. Warden, can you just confirm you can see my screen?
Yes, we can.
Okay, thanks. Okay, the first report is on our Ministry of Health service review that took place in 2019. So this report is for information. So in order to meet our legislative requirements, the paramedic service has to have a service review completed every 3 years. This report stems from the service review in October of 2019. We didn't receive the final draft or final report until January 14th. So that was the delay in getting this to council. The findings in the report indicate that we've met the requirements of the service review, and our license has been extended through till June 2nd, 2023. Generally, this process would take, from the time they do the service review to the time we do all the follow-up. Generally, if it's in the fall, we'd have it cleared up by the spring. But due to COVID, it took longer to go through this process. The service review consists of a 2-day on-site review with Ministry of Health inspectors. They look at all aspects of the service, the administration, the operations, and their quality assurance program. They have people out in the field riding out with crews, looking at our vehicles. They have a vehicle specialist come from the ministry. They more or less look at every aspect of the service and how we run our business. We don't ever know what the exact score is, but just based upon the findings, we know that we did well through the review. The final report does outline some observations that were noticed through the review. There were 6 observations noted, and comparable to 2016 where we had 4. All the observations that were reported have been addressed, and that's what takes part of the process is they send the draft report, and then we respond to that with our follow-up to the observations, and then we meet with an inspector again and close off the review. So all of those observations have met a satisfactory conclusion. So this slide just gives you an idea of the service, how it performed against 2016 and also against the provincial average. So you'll see we have 6 observations. The majority of the results were 100%, but again, anything less than 100% creates an observation. So we find this as a good learning of time, and we can improve our processes through this. So that just breaks it down between patient care areas, quality assurance, and administration. In 2016, we had 4 observations. In 2019, we had 6. The provincial average is 10.6. So the success of our service review, it really falls to everyone, the paramedics, the management team, county council, and the CAO, and also the support of all the different departments, transportation, finance, human resources, JS, IT. Again, we more or less work with every department within the county. It's really a big team, and thank you to everybody that's assisted with us in this. Even though we were successful, we still look at ways to continually improve, and our goal is always to go into this with no observations, and we run the service each day as if the service review will happen tomorrow. So we have processes in place that we continue to follow, and again, we try to make them better wherever we can. But overall, very successful review.
Thank you very much, Kevin. Council, are there any questions? Maybe we could get the full screen again so I can see everyone. There we go. I don't see anyone's hands. If that's the case, I'm going to call the question on the motion to receive this report. Is there anyone opposed? Seeing none, we'll move on. Next, we're on item C, in the Grey County Community Paramedic Program expansion. That is being moved by Councillor Hutchison and seconded by, that has been moved by Councillor Patterson and seconded by Councillor Gamble. And Kevin, once again, you have the floor.
Okay, second one here. This is about an expansion proposal for the community paramedic program. This is a fairly new request. We didn't get the information until early to mid-December, and it's around for us putting in a proposal about expanding our community paramedic program. So this is a report just to be received for information. So our community paramedic program, that we play an important role supporting vulnerable patients in their homes. We provide home visits as a part of our community paramedic program to deliver care under the direction of a physician with an expanded scope to treat people living with chronic disease. The whole idea is to support these people in the home and keep them out of the hospital. We've been operating a community paramedic program for over 6 years now. So the Ministry of Long-Term Care, which is new for us because generally comes from the Ministry of Health, this has reached out to us through the Ministry of Health as well, looking for proposals to expand our community paramedic program. This program is to work with the local health integration network, our local LIN, as a capacity enhancer to work alongside community care to assist patients with higher needs in the community and to allow them to stay in the community. The patients they'd like us to focus on, and I would argue say that's most likely the patients that we see today in our program, so it's a good fit, are people that are on the wait list for long-term care. They've been assessed to be eligible for long-term care, or people that could soon be eligible for long-term care. So we've been selected as one of the municipalities to put a proposal in for this initiative. It is 100% funded, and it's a 3.25-year commitment, which hopefully would go longer. The county's proposal includes a plan to implement the program by March 31st, so it is a short turnaround. The annual funding allotment for this is up to $1 million, and in the first quarter of this year, before the government fiscal, it would allow us to bring paramedics in, train them, and prepare, as well as to purchase some capital equipment to help start the program. If our proposal is accepted, the province will forward the agreement to be approved by council, but we hope that it'll be approved in the next few weeks, so if we can start the program before the end of March. We put a proposal that will allow community paramedics to be across the county. It's something that we've wanted for quite some time. Right now, we do our best to focus on as many areas as we can, but most of it is focused in the Owen Sound and surrounding Georgian Bluffs, Meaford, Chatsworth area through the Owen Sound Family Health Team. But this would allow us to reach out to other community health centers, family health teams, SPOs, and then even individual primary care physicians to offer this program. And we'd hope to be able to offer it to another 300 to 350 patients. And that could bring our roster close to 500 patients with this initiative. To expand the program, there is a capital investment. The biggest expense is around vehicles and to a lesser extent, ISTAT machines. The cardiac monitor defibrillators would be purchased in the first quarter, but there is a fair capital request. To maximize boots on the ground, what we did is built the budget so that the money would be brought back over the next 5 to 7 years instead of upfront paying it. There is a bit of a risk here because the program is only guaranteed for 3 years, but our thoughts are and hope that it would carry on similar to what the program we have today. And if not, we would look at either using that equipment within our 911 system or selling it if there wasn't a need for it. So we're looking at building upon our well-established community paramedic program. We do have strong partnerships in the community, and we hope to be able to make it stronger to support the patients that we serve today. And again, spread it out to the entire county. And I'll take any questions.
Thank you very much, Kevin. I'm gonna look to council to see if there are any questions. I see Councillor Mackey. Go ahead.
Thanks, Mr. Warden, and thanks, Kevin, for the report. I think this is a tremendous opportunity. Just curious about how many other pilot sites is the province looking at?
There was initially 5, and then with this one, I believe it's 29. I'm not 100% sure, but I believe it's 29. What they looked at is services that are already established and will be able to get up and going with community paramedic programs. Hopefully that the plan will be, though, is that all municipalities will have this type of ability to move this forward.
Councillor Milne.
Thank you, Mr. Warden. A comment and then 2 questions. My first comment is I'm always really leery of these programs that the province is going to fund for a limited period of time, and then we'll see whether it works or not. Well, my way of thinking, this program has huge potential, and it's a great idea. So I really hope the province would carry on with the funding after the 3 years. But there, as Kevin has noted, there's no guarantee. My 2 questions is, first question is, what type of vehicle would the paramedics be using when they are doing community paramedicine? And the second question is, as we build the roster of staff to look after these folks, would those paramedics be cycled, so to speak, through frontline paramedics as well, or would it be people dedicated exclusively to paramedicine?
So the first question is around the vehicle. We do have a vehicle right now that we've actually spec'd out of the city of Ottawa. It's a smaller first response vehicle. It's all-wheel drive. It's I believe it's an Explorer. So it's like, but the big thing is for, you know, in and out of driveways and stuff like that, and winter weather, it's nice to have that all-wheel drive. It's fairly compact. It meets the needs of what equipment we carry. We do outfit this to be an emergency response vehicle. So there is a benefit on that side as well, that when we add these extra vehicles, they listen to the radio, and really what we're adding is we have one out there right now and another 3. If a cardiac arrest comes in around the corner, or if there's a high priority emergency call, they will do first response. So it is a capacity enhancer even for us on the 911 side, even though that's not their primary role, that they become available to us for stuff like that. So it's very positive on that side. And so that kind of goes into the next question. All paramedics that work in this field are considered primary care paramedics with intravenous certification. They need to have those 2 things. And so what we generally have paramedics that support this in a full-time capacity. And then we also train people to be in a part-time for backfill, because as much as we say having a full-time staff, if they go on vacation, it's 100% backfill. There's no gaps. So we can't really have gaps if we're carrying that many patients. So we do have a part-time and a full-time complement. The full-timers, though, especially when we have capacity, we've noticed even when first response and certain things around the community side of things, to keep your skills up, it is good to cycle through the 911. So to give them options to do 911 shifts, 2 to 4 a month. And also that some of them like to also circulate through our alternate rate supervisor role to give some of those opportunities. So there is a bit of it is a combination role. And there will be ones that are primarily in community paramedic with some opportunities to do 911 shifts. Then the part-time are generally part-time staff or full-time staff working in the 911 that backfill in the community paramedic role.
Excellent. Thank you, Kevin.
Thank you, Councillor Potter.
Thank you, and thank you for your presentation, Kevin. A couple of questions. The first one is, my understanding is that these programs keep a lot of people out of hospitals and in a way pay for themselves. Do you have any information on that?
Yeah, they have been shown to keep people out of the hospital, keep them out of emerge, drop 911 calls. There is a study by Queens that we had of 500 patients. We had over 100 patients in that study that showed a very positive return on investment in this program. We see it every day. We work with the patients. We talk to them about their disease condition. We want them to call us, 3 days before they reach that emergency, where they would have called 911 in the past, where we can send a community paramedic out, do the assessment, connect with their community care provider, and then offer treatment. Generally, it's around antibiotics for a respiratory infection, maybe prednisone for that to help them breathe, different inhalers, could be an adjustment to their water pills. We do blood work, those types of things. Now we've went into the palliative side of things, where we do acute symptom management in the home as well to keep them in the home. So it keeps broadening out, and I think that as we learn and grow, there will probably be more opportunities as well.
That's great. That's good to hear, because, I think the value of things is more important than the cost, and this one has a high value. Secondly, you do work with the health teams. As you know, we cross over into Simcoe County and Collingwood area here. So is there an overlap, or how do we deal with that crossover?
Well, as far as like working with Bruce County, like experience with them, if the patient is a family care, primary care provider within Gray, we will see them outside of the county. There's not very many of those, but there are. I know that Simcoe County has a community paramedic program. Bruce is actually working towards implementing one. I think there is sharing back and forth. It makes most sense for where the primary care provider is, because that's who gives us the medical delegation, where that would come from. But so there is a cross-border mechanism especially with our surrounding. Dufferin has a CP program. Simcoe, Wellington does to a certain extent, and then Bruce County is moving ahead in that area too. So again, my goal hopefully is to see this grow across the province.
Great, thank you.
Thank you. And just to follow up on Councillor Potter's remarks, it might be good, Kevin, for us to, record some of those stories. So, for example, patient A over the last year visited the emergency ward X amount of times, or called for 911 assistance this amount of times. And since the community paramedic involvement, it's been reduced from 10 to 2 or 1.
And that has been looked at in the past. If you read the Queen's study, they actually talk about that. They reference the number of calls, and that will be part of this. This program will be continued to be evaluated. So those are one of the things that they will be continuing to look at.
Very good, thank you. Any other questions? Seeing none, I will then call the question on the motion to receive. Anyone opposed? That too is carried. Thank you very much, Kevin. Okay, we're on to item D. And that is the updated code of conduct. We have Madam Clerk on deck. It's being moved by Councillor O'Leary and seconded by Councillor Carlton. Madam Clerk, you have the floor.
Thank you very much, Mr. Warden. As Council will recall, the original report was presented in late 2019 regarding the adoption of a new Council Code of Conduct. The code was written by the county's Integrity Commissioners, Principals Integrity, and provides an outline of rules contemplated within the code, as well as some commentary and examples to provide further information. As a brief overview to the original report from 2019, the code provides for more definitions of clarification, and it's guided by a number of rules set out within both the Municipal Act and the Municipal Conflict of Interest Act, among other pieces of legislation. It establishes a formal and informal complaint process and a reporting requirement to the Integrity Commissioner and an updated complaint form. Grey County Council does have a code of conduct, which was completed prior to the requirement under the Municipal Act to have an Integrity Commissioner. And with Principals Integrity being hired as the county's integrity commissioner in 2018, the code of conduct needed to be updated. The updated code provides for the new requirements under the Act. When the code was first presented in late 2019, the code was endorsed, the bylaw was deferred pending training for council by Principals Integrity. This training was completed at the end of 2019, and it was opened up to a number of our member municipalities as well. Both Jeff and Janice from Principals Integrity came to the county to Grey Roots, and we had a very successful and in-depth training session at that time. Since the original report was completed, the only changes made to the Code of Conduct are in relation to the commentary related to rule number 15. And that's on page 73 of your package. It now includes information related to two-tier systems relative to the council decision-making process, as well as information related to potential conflicts and legal challenges or litigation processes. It is important to remember that this is a living document, and it can shift and change as legislation is updated and new councils are sworn in. The Code of Conduct will be brought forward at least once during each term of council for review and updating as necessary, as well as when new legislation or policies are enacted that require updates to be made. I am working with Principals Integrity to bring them virtually to an upcoming council meeting to provide their annual report to council, and that will give council an opportunity to ask them any questions in the work that they've done over the last year and a half. And if the report and the code is endorsed, a bylaw will be brought forward then for council's consideration. Thank you.
Better on mute. Councillor Soever, I see you first.
Yes, I want to thank staff for bringing this forward, and particularly some clarification as to how things work in a two-tier system. I believe I had raised that issue, but I don't see any clarification on the legal aspect of it. That really hasn't changed, and it's not really addressed in the new Rule 15 commentary. And my question at the time, I think, related to what happens when you're the mayor of a lower tier that's in legal dispute with the county. And that at the time was an LPAT hearing with regards to where we were on opposite sides of that. And the county had allowed a rezoning. We had not agreed to it. And so that's why I thought, you know, when you're the mayor of a lower tier and you are in legal proceedings, Rule 15 would seem to mean you're out of order. I am glad that there is a bit more commentary, but I think that's something that needs to be addressed. Whether you can, you know, as the mayor of a lower tier, you know, you're involved in the legal proceeding because, you know, that's what council has wanted you to do. And, you know, it does say that council can't compel you to do anything at the county level, but it still seems to be a murky area. And, you know, we don't have the problem anymore at the task force level because the Blue Mountains Task Force, of course, has been wound up, but there is the new commentary on section 15 says, the higher obligation in that case would be to exercise due care and diligence in determining how to vote in the best interest of the municipality where the vote is being taken. That would mean at county council, you have to put the county first while taking into account the context provided by positions taken by the other municipalities. So, you know, that is an interesting question. And particularly when it comes to where you have a task force like the Hanover Owen Sound Task Force, which is, you know, focused on Owen Sound and Hanover issues. And that would imply that, you know, there could be a difficult situation created for members of that task force. So I'm just wondering if some clarity on that might be warranted.
Madam Clerk.
Through you, Mr. Warden. It's certainly something that I can ask Principals Integrity to speak to when they come and provide their annual report and provide that clarity. We did speak about it at the orientation, is that, you are elected at the local level, but when you come to county council, you are looking at the council as a whole, and any task forces. So for example, the Hanover Owen Sound, as much as it's looking at items related to Owen Sound and Hanover, the resolution originally was, and its impact to Grey County as a whole. So we are looking at the entire county at that point. So it certainly, Councillor Soever, it's something that I can specifically ask Principals Integrity to provide a little bit more clarity on when they come to present their annual report later this year.
Thank you, Madam Clerk, and that would be much appreciated.
Great, thank you, sir. I don't see any other hands. Is there anyone else with questions? Check my other screen. Nope, I don't see any hands. So that said, I will, Councillor Soever, your hand is up again.
Oh, I forgot one thing. As when we had our one-on-one meeting, Mr. Warden, that it was an interesting idea that perhaps if county councillors were elected separately from the mayors and deputy mayors, then they wouldn't have this issue. So I'm just throwing that out there. Maybe that's something we could talk about before the next election.
Thank you, sir. Anyone else? I do not see anyone. If that's the case, then I will call the question on the motion. Is there anyone opposed? And seeing none, that is carried. We will move on. Next, we're dealing with item E, the Development Charges Steering Committee, terms of reference. Madam Clerk, you're on. No, this is going to be Randy, isn't it? It is being moved by Councillor Potter and seconded by Councillor Patterson. And Randy?
Thank you, Warden Hicks, and good morning, everyone. So the county's development charge bylaws are set to expire on January 1st, 2022. And municipalities are required to do a development charges background study update and to update the development charge bylaws every 5 years. Development charges allow the county to better plan for capital-related services attributed to development and growth by ensuring that funding is available to undertake the necessary capital projects. As part of the previous development charges review, a development charge steering committee had been set up to oversee and provide direction to the consultant and staff in preparing the updated background study and bylaws. And staff are recommending that a similar process be taken for this review. The 2021 capital budget includes funds to hire a consultant to update the background study and the DC bylaws. And this report provides terms of reference for the steering committee and recommends that these be endorsed and that members be appointed, including the warden plus 4 county councillors. And that's all really with respect to this matter. And obviously, once the DC steering committee is set up and the consultant's been retained, then we'll be obviously getting into more detailed discussions about the development charges review.
Thank you, sir.
Mr. Warden?
Yes.
I will note that the terms of reference call for 4 council members. I did receive interest from councillors Carleton, Keaveney, and Woodbury. So there is one spot position if anyone else is interested in this committee. And I think in discussing with Randy, the meetings are going to be 3 or 4 at the most over a few months. Am I correct in that, Randy? So it's not like it's going to be every month. It's going to be a beginning, a middle, and an end.
Yeah, that's how we see it unfolding. That's consistent with previous reviews for sure.
Okay. Thank you for that clarity, Councillor Soever.
Yes, I'd volunteer for that committee.
Thank you for doing so. And I don't see anyone else with their hand up, so we won't need to have an election. If that's the case, then do we need to have a formal motion, Madam Clerk, with respect to the members?
We will
Or is
just,
that covered by the main motion?
yeah, it'll be covered by the main motion, and we'll just include that Councillors Carleton, Keaveney, Woodbury, and so ever, along with yourself, are the members of this steering committee.
Excellent, then. Thank you very much. I don't see any other hands up, so I'm going to call the question on the motion as presented. Is there anyone opposed? Seeing none, that is carried. We're on to item F, the loan agreement with Owen Sound Housing Company. And Marie is on deck for that. And the movers are Councillor Hutchison and seconded by Councillor Burley. Anne Marie?
Good morning, Council.
Morning.
Last year, I was before Council asking for a loan in the amount of $3,250,000 to support the development of 60 affordable and market units being built in Owen Sound. Since this time, I have received a request from Owen Sound Housing Corporation for an increase in the amount of the loan. They did go out to tender, and Allen Hastings Limited, a local company, was the successful bidder. The project did come in over what they had estimated. Their consultant had thought it would come in around $11 million for the build, and it came in at $12,543,000. So they are asking that the short-term loan be increased to $4 million.
Anne Marie, can I just interrupt you for a quick second? It seems that your sound is going sort of in waves. I don't know. That's my experience anyways, that it's soft and then fine again. I see other heads nodding. Is there anything on your end that's causing that?
I'm at work, so it's not my internet. Okay, I'll try again. So I'll back up to the point where we had previously approved a loan for $3,250,000. Since then, they have gone out for tender. Allen Hastings Limited was the successful bidder for the tender. It did come in over the estimated amount. Their consultant had originally thought the building would come in around 11 million. It has come in around 12,500,000. So they are asking that we increase the short-term loan to $4 million. So this is just asking that we rescind the original resolution of $3.25 million, increase it to $4 million, and that it be over a maximum of 2-year period instead of 1, just due to COVID and delays, just giving them opportunity to get the project built. And there is an agreement attached, and there will also be a security put on for the loan on the project. And I'd be happy to answer any questions.
You are on mute, Mr. Warden.
When are we going to learn, right? Thank you very much, Anne Marie. I'll repeat. And Councillor Milne.
Thank you, Mr. Warden. Anne Marie, because the bid has come in at 12.5, does that include contingencies in there? And,
yes,
have they been increased in a similar proportion so that the 4 million that we're hoping to extend them, they won't come back in 6 months and say, oh, we need 4.25 million. I mean, I'm in support of extending this loan, but I just want to make sure that this is enough.
Yes, so the proposal that did come from Allen Hastings did have a larger contingency than what the consultant had originally proposed.
Excellent. Thank you.
Thank you, sir. Councillor Burley.
Thank you, Mr. Warden. Anne Marie, is this particular project a bonded job?
I would assume, I'm sorry, I don't have that information offhand, but that's normally something that is asked for in our tenders. So they use a similar process we do.
Okay, I would think it is. I'm just want to make sure that the county is part of that documentation for bonding.
I will certainly look into that. Thank you.
Thank you.
Thank you, sir. Any other questions? Seeing none, then I will call the question on the motion to rescind, and we have the new amount in place. Anyone opposed? That is carried. Thank you very much. We're going to go back now to the consent agenda, dealing first with item A, the Hanover Owen Sound Task Force minutes of January 11th and 15th. I'm going to look for a mover. I'm going to suspect that Councillor Soever will move.
I'll move.
And I need a seconder. Councillor Burley. Councillor Soever, you have the floor.
Yes, the reason I pull these minutes is, I'm just want to thank the task force for doing all this work. And there's a couple of things. One was a little ambiguous in the January 11th minutes on page 3. Where Miss Wingrove spoke about the provincial offenses fine revenue. And so it seems like the municipality lays the charge, gets the money back, then administration fee. Is there a policy on that? And I would also notice that the fine revenue from traffic offenses is used to offset court operation costs. We do pay extra for an OPP officer that is dedicated to traffic. And so is there, information as to, how hard everybody's working on, getting some of that revenue in so that we can offset some of those offenses? Because certainly I think, the court security costs that are borne by Owen Sound could be offset by additional revenue there. The other thing is when we're talking about the casino, it says the calls for visitors to the casino of approximately 800 to 1,000 per day. That's not the number of calls, is it? It's the number of visitors. Yes, and it says the calls spike during the day from 10:30 a.m. to 5 p.m. and rise during the progression of the week with the highest number of calls on Friday. So how many calls would there be? When I saw it says calls and I saw 800 to 1,000, I thought that's a lot, but does anybody have an idea? Because it is kind of ambiguous there. Nope.
You're on mute.
Mr. Warden, you're on mute.
Sorry about that. I see Councillor Patterson waving her hand.
Yes. Thank you, Mr. Warden. And yes, it is a little ambiguous. It is 800 to 1,000 visitors to the casino. And the actual calls, I don't have a number, but would not be anywhere near that. And those calls actually happen outside of the casino in the parking lot. So, and for reference, I can probably find that out for you for next meeting. But I think if we just added the word see, the casino sees approximately 800 to 1,000 visitors, should take care of that.
Thank you. I was suspecting that would be the case. So the casino obviously is a good source of revenue for Hanover with about $1.4 million of revenue a year, according to the 2019 FIR. Obviously with a number of calls, it also adds to the policing costs. So I think, I'm hoping the task force, looks at some of these costs as well. That's all I have on the minutes of the 11th. On the 15th, I would just note that the minutes of the 15th have on the title, it says January 1st and not 15th. So I think we need to change that. And that's all I had. That's why I pulled those items.
Excellent. Thank you very much. You're quite right about the first. Did we answer all of your questions?
Yes.
Excellent. Any other questions from anyone else? Then I'm going to call the question. Is there anyone opposed to approval? Seeing none, that is passed. We'll move next to item 5C, the SWIFT project update. I'm going to assume, Councillor Soever, that you'll move it.
Yes.
I'm looking for a seconder. seconded by Councillor Milne. And Councillor Swever, again, you have the floor.
Yeah, I greatly appreciate this update from Swift. We've been asking for more information for a while, and certainly this is a great improvement. And I'm wondering, there was talk for some time of the Swift representative coming to council so we could ask questions and find out more. Is that still in the works?
I'm going to turn to Madam CAO on that. I know that it was in the works pre-pandemic.
Yes.
But I think that since the pandemic, it's been off the table, correct?
Yes, and I think we were, prior to the award of the Grey County projects, when things were still under that assessment, I think there was, a little bit of reluctance there. It wouldn't have been the most fulsome update for council while they were still considering the responses to the RFP, but certainly all of that is behind us now and projects are moving forward, as you heard earlier in our meeting today. Are there specific areas of interest, Councillor Soever, that you're wanting to have Barry focus on? If you can let me know, then certainly I'll reach out to him again and see if he can make himself available.
Yeah, certainly. I'm very encouraged with the rate of progress and the number of projects that are now been initiated. But, I have expressed my concerns, and I continue to, that some of the projects may be a little unusual given the branding of Swift, where it's rural broadband. And I see, even on the website, they're moving more toward that branding. But, there are a number of projects that when you look at the projects, particularly the Garafraxa Woods one in the corner of Orangeville, which is a subdivision of wealthy individuals with an average, as I said earlier, of property. When you look at the real estate listings for that thing, they average $2.8 million, and you're servicing about 40 homes per kilometer, and you're picking up high-end customers. So I just wanted to, ask what can be done to move more toward the truly rural areas. Because once you pick a few of those subdivisions out, it makes an area, if they're already serviced, then the adjacent rural area is far less attractive than if you could say, okay, if you want that high-end subdivision with all these wealthy people that are likely to buy a whole package of services, then you've got to service, to bring your average density down, you've got to service the surrounding rural area. And I think that's a very important thing. And like to learn more about Swift 2.0 as well.
Okay, I will provide those comments to Mr. Field and ask him if he would attend. To a point that was made by the warden earlier today, I think that it's probably important for us to review the circumstances and the criteria under which SWIFT was provided funding to begin with. And, to some degree, their hands are very tied. They need to meet the criteria that was set out for them by the federal and provincial governments. I will ask Barry to speak to that when he comes. I'm a little bit uncomfortable about the focus on the socioeconomic place that individual people face. I don't think that enters into the discussion. It really is about the number of premises being served, not whether or not they are well resourced or not. So I'll ask him to clarify that.
Thank you.
Thank you. And I would just add that SWIFT endorses the hashtag broadband for all. Councillor Milne.
Thank you. I just had a very somewhat similar concern when I saw the downtown core of Drumore being serviced, and yet those of us in the suburbs get none. So anyway, it's I'm just tongue in cheek there a little bit. Thank you.
Well, I can agree with that. If the criteria said if you want to do downtown, you got to extend it another baseball throw, then certainly that would be a good suggestion.
Absolutely.
That would certainly please Councillor Mill. Okay, are there any other questions on this item? I do not see any. So I will call the question. Is there anyone opposed to approval of this item? Seeing none, I'm going to say that that is carried. And we are moving to item E next, the Blue Mountains Village Association, that letter of support, moved by Councillor Soever and seconded by, I'm looking for a hand, Councillor Potter. And Councillor Soever, once again, you have the floor.
Yes, so I really appreciate this letter being issued. I was authorized to write Premier Ford with a similar letter from the town of the Blue Mountains. Certainly our resort well, let me start by saying with the COVID stats around, there certainly is a need for a lockdown. And, I think the provincial government was correct in bringing in a lockdown. I wish they would have done something more strict sooner, and we wouldn't be in the situation we're in. Australia did a real lockdown where you could only leave your house for an hour a day, and they managed to squash the thing. And they, instituted new lockdowns in Sydney, for instance, when cases reached 148 in the entire Sydney area in a week. So, they moved earlier and quicker. But with regard to the Blue Mountain Resort and the village, certainly they've been very responsible all through the pandemic. They've instituted protocols and procedures all summer. They painted all their sidewalks so it was one-way traffic. They brought in wearing of face masks, mandatory far before anybody else. There were a lot of protocols, and Dr. Era informs me that there's been no documented transmission in any of our tourist businesses of COVID, as far as that we can tell from his contact tracing. So I did ask him about that when I was writing my letter to Premier Ford, and so the resort's been very responsible, and they've worked really hard in putting together protocols, which you see in the letter, reduced capacity, the wearing of masks even outside in the village, closing down all common areas except for the washrooms inside. So people would actually have to put their boots on out at their car, go on the hill, limited opportunity to gather. And, I think that they're doing an excellent job in preparing for a safe reopening. So our focus is really, let's have the local medical officers of health be in charge of a safe reopening, whereas the one thing we don't want to have in the resort has expressed concerns about as well, is we don't want the province just to say, okay, it's closed and now it's open. And all of a sudden we get hundreds of thousands of people up here on a Saturday. If the reopening was, say, on a Friday, it would be a disaster. So the resort is talking about, having some assurity that, there is a plan for the reopening and maybe phasing it in starting on a Monday. And they already have a plan for pass holders only. So it would be the people that regularly ski here, and you wouldn't expect to get a large influx of day trippers because there just wouldn't be the skiing. I mean, no more than we're already seeing on all our trails and things. But so I just wanted to provide a bit of color on that. And certainly we continue to work with Dr. Era and the resort to make sure that there is a plan for a safe reopening. And I think one of the things that really highlighted to me looking at the statistics is that the town of Blue Mountains, relative to its number of households, other than George and Bluffs and Chatsworth, has the lowest incidence rate of COVID per household, like total cases. since the beginning of the pandemic. And if there was really a problem with tourism and visitors and seasonal residents, then you would expect us to have the highest rate. So I think everything the resort and we're doing seems to be working, and thanks goes to Dr. Aaron helping us implement those procedures. And so I really do support this letter.
Thank you very much. Anyone else with comments to add? Thank you. Then I'm going to call the question. Is there anyone opposed? I see none. So I'm going to say that that too is carried. Okay, we're on to item number 7 now. Is there any other business? I see Councillor Potter. Go ahead.
I think I accidentally hit the button. I didn't mean to. Sorry about that.
That's all right. Councillor Milne.
Thank you. Just a quick question to the clerk. I'm wondering where that notice of motion for the land acknowledgement landed.
Through you, Mr. Warden, that report is just about finished, and I should have it at either the first or second meeting in February.
Excellent. Most excellent. Thank you so much.
You're welcome.
See, Councillor Milne, it's not all bad in your world.
And no one ever suggested it. It's all bad in my world. It's just some bad.
Anyone else with any other business? I would just like to, perhaps under other business, give kudos to one person around our horseshoe, and that's Councillor Desai, who I think does a terrific job of reviewing the package and getting questions that he has, on the agenda in advance to staff, and sometimes he'll even copy the warden. And I think it's a good thing. I would encourage councillors, if you have questions with respect to the package, it might be a good idea to do as Councillor Desai regularly does, put out your question to staff so they can, come fulsome, prepared, be able to assist, and perhaps even address those questions when they make their presentation of their reports. I know, Councillor Milne, you're dying to comment about my complimenting Councillor Desai.
Don't encourage him. Don't encourage him.
All right. Is there anyone else with any other business? I see none. Moving then to item number 8, any notices of motion? I do not see any. And so we have just one item left, and that's a motion to adjourn. That's moved by Councillor Burley and seconded by Councillor Potter. Anyone opposed? I see none. So that's carried. Thank you very much. And we are done before noon. Wow. Have a good day, everyone.
Good job,
Thanks, everyone.